Navigating soft cataracts can be hard, especially for an inexperienced phacosurgeon. The inability to hold or grip the lens with a phacoprobe makes surgery extremely challenging. These are some of the hardships faced by a phacosurgeon while handling a soft cataract. Direct chop is one of the most difficult techniques to perform on a soft cataract. There is inadequate hold and the nucleus gets aspirated with vacuum. Mechanical chop needs advanced skill and usually can lead to incomplete chops. Even the simple maneuver of rotating the lens itself can be a challenge in soft cataract and can lead to cheese wiring of the nucleus. Stop and chop involves making a trench. In this technique, even if the surgeon is able to achieve the right depth of the trench, the surgeon ends up with an incomplete separation of the hemisphere because of the softness of the lens. There are also chances of the posterior capsular rupture as the phacotip is very close to the posterior capsule and makes things more complicated. This is one of the most common situations encountered while managing a soft cataract. Most times, while doing a divide and conquer in soft cataracts, inexperienced surgeons end up creating a saucer in the center. While trying to extract the surrounding rim of the nucleus, end up having a punch hole posterior capsular rupture.
Complications happen to the best of us. Making mistakes is part of the journey. Embracing your journey and improving your technique will make your surgery much easier. Believe in yourself.
There are various other techniques to tackle such soft cataracts, but they are very difficult as they require really good coordination of both the hands, and the phacotip is usually very close to either the endothelium or the posterior capsule. At times, the complexity of these techniques may introduce a sense of apprehension, potentially leading to an inclination to evade addressing soft cataracts. Although these methods are effective when performed by a very experienced surgeon, is there a more simpler technique that any level of phacosurgeon can use to address soft cataracts with minimal complications? Introducing the smile technique. With growing awareness of cataract, the number of patients with soft cataracts undergoing phacoemulsification has increased. There's a growing demand for a more easier, efficient technique. We bring you the smile technique, which will change the way you look at soft cataract. Doesn't that bring a smile on your face?
Wow! Awesome! How did you do that?
After a good hydrodissection, use the highest flow setting possible in your phaco machine with which a stable chamber can be maintained throughout the surgery. Stability is very important. 45-degree phacotip is used with the bevel facing down and the tip is kept at the level of the anterior capsule. Starting superiorly in foot pedal step 2, the first sweep is made where the phacotip is moved along the rhexis margin inferiorly in a smile fashion. This creates a smile trench between the temporal and the nasal part of the lens. The second sweep debulks the nasal nucleus first, and then this helps to attract the rest of the nucleus to the phacotip. There are numerous benefits of using this technique. Its simplicity ensures a swift learning curve, making it an ideal option for any level of phacosurgeon seeking proficiency in cataract surgery. It is a simple, quick method and it takes just about 14 seconds. It is a single hand technique which makes the learning curve very short. The high flow and high vacuum settings make the lens come to you rather than you go after the lens. Because when you go after the lens, you end up going very close to the posterior capsule, leading to a high risk of complication. But you should always make sure the chamber is stable at all times. The phaco tip is always kept at the level of the anterior capsule and always away from the posterior capsule and endothelium, unlike in other techniques where it is either very close to the posterior capsule or the endothelium. No phaco power is used in this technique. The nucleus is aspirated in vacuum alone, which minimizes the risk of corneal endothelial cell damage. So basically, the smile technique is a simple, single-handed technique which, with the wink of an eye, you will be able to smile your way through soft cataract.